Hi everyone, and welcome to the next episode of the Explain series with the host, Dr. Bret Palmer. I get comments about 2 times a week on how to get rid of hard smegma. So what is hard smegma? Smegma is dried excretions that are under the foreskin. So if you're circumcised, you will still produce smegma, but chances it won't stick around. But if you do have a foreskin and you don't retract it very often, then you will get that hard smegma build-up, and usually around the corona or head of the penis. So what do you have to do to get rid of it? If it's been building up over a number of months or even years, it's going to take a little time to get rid of that substance, and it can be very, very hardened. The best thing to do is attempt to retract your foreskin. Now, retracting your foreskin if you're young can be very, very difficult and painful, and if you're having trouble retracting your foreskin and you're younger than, for example, 18, just take it easy. It could very well ease up in your late teens. If, however, you've never been able to retract it, it's always been a little bit difficult, and you can't really get even the foreskin over the head of the penis, and you're over the age of 20, don't worry about it. Probably don't need to do anything. If you're able to do everything you need to do and it's functioning as normal, then there's no reason to necessarily get a circumcision or get a dorsal slit or any other types of treatment out there. So there's various devices that some people buy, which are like stretching rings that can stretch the foreskin to enable an individual to retract it easier. If the functioning of the penis is completely normal and you're unable to stretch the foreskin, don't worry about it. The inside of the penis can sometimes be self-cleaning. Weirdly enough though, if you're able to retract the foreskin and you don't, then your penis may need a little bit of extra help, especially if you've got that build-up of, as I said, hard smegma. So how do you get rid of the hard smegma? Well, how you get rid of any stubborn, crusty material from anything is you probably soak it in water. So the best thing to do is take a leaf out of the Japanese and have a Japanese bath. What that means is have a nice warm bath, no soaps, no emollients, no chemicals in the bath, just plain, nice, warm water. Get in it, have a nice soak, and then retract the foreskin. Now, if you're young and the head of the foreskin is very, very sensitive, this is a good way of helping or starting to desensitize that head. But obviously, if the water's too hot, it's going to be a little bit uncomfortable. Either way, retract the foreskin and allow the water to soak into the hard smegma. Once you've had about a 20-minute soak, obviously wash as normal, but don't use soap, use an emollient. An emollient like E45 or Dermal 200, they're common products in the UK, but if you just put emollient soap substitute in the internet, you should get a whole list of emollients that are available in your country. Now, emollient doesn't produce any soap because it doesn't contain any surfactant, so it looks like a little bit like a moisturizer, but it's not a moisturizer. A lot of soap substitute emollients should be put on wet skin, washed off, and then you just dab the area dry. If you do have hard smegma, you have to repeat this process over the coming days and weeks, and it will slowly loosen up and it will reduce. In terms of general foreskin or penile hygiene otherwise, well, let's start from the beginning. When you pee, stand up, retract the foreskin. If, however, you're of an older generation and you've got an enlarged prostate, it may be more comfortable for you to sit down. Either way, still retract the foreskin. That allows air to get around the head of the penis and the underside of the foreskin. It's very, very healthy for the penis to have a little bit of an airing every now and then. After you finish peeing, if you're in a private bathroom, so you can't do this in a public bathroom obviously, you then splash some water on the head of the penis just to take away the last few bits of urine away, and then dab it dry. Now, if you've got an overly sensitive penis, keep the foreskin retracted, and then that will help over time to reduce the sensitivity. And it's fine and completely normal to have an extremely oversensitive penis a few years after puberty. It just takes one of these things, it takes time for the sensitivity to decrease. Other than that, if you are suffering from any kind of rash on the penis, on the head of the penis, or sensitivity, retract the foreskin, keep it retracted for about half an hour to an hour if that's comfortable. If it's not, it may be something you have to build up to because the head of the penis can be very, very sensitive. But don't fall asleep with the foreskin retracted, otherwise it can swell up. And that effectively is penile hygiene. So Clean it on a daily basis. Don't use soap though, just use water. If you've got hard smegma, soak it, then wash it with water or an emollient, and keep the foreskin retracted if you have a little bit of a rash or sensitive skin, and that'll help reduce it. Other than that, look after the penis, and the penis will hopefully look after you. Anyway, take care and see you in the next episode. Bye-bye.